مساء الخير. نبلش.
Good afternoon. We shall start. Allow me first of all to welcome the media anchors and the journalists and to thank them for accepting the invitation of MSF for this press conference that will shed the light on the humanitarian situation in Yemen, particularly the escalating malnutrition according to the witness and the testimony of MSF teams in Yemen. We will discuss malnutrition faced especially under the collapsing and vulnerable healthcare systems and continuous years of conflict and instability. We will have also a Q&A session with MSF, and it's going to be in English and in Arabic. Allow me to present MSF team, Mr. Ahmedan Mohammed, who is the head of operations for MSF Middle East. Ms. Illyria Rasulu, the head of medical mission for MSF, and the medical coordinator, the head of the mission of MSF in Yemen, and Ms. Marissa Lister, the medical coordinator for MSF in Yemen. Allow me to invite Mr. Hamidan for his opening statement to present the situation in Yemen. Assalamu alaikum, peace be upon you. Ramadan Mubarak to all of you. Many happy returns, many blessings of Ramadan I wish to be shed on all of you. We know that malnutrition continues to threaten the health lives and of countless of people in Yemen, and some of our latest findings in Yemen in 5 governorates, Amran, Saada, Hajja, Taz, and Al-Hudaydah, remind us of the striking humanitarian toll that are exacted by years of conflict, instability, and reduced access to basic services and basic needs and basic health care services. It's a deep humanitarian crisis that actually outstrips our capacity to cover the needs, and the capacities between January 2022 and 2024 supported by MSF treated 35,000 and almost 500 malnourished children under the age of 5 years old. In addition, MSF has scaled its capacity, yet these facilities are left overwhelmed with children that are malnourished, especially that a lot of them suffer measles and acute watery diarrhea. During the peak and malnutrition season, and in the facilities supported by MSF, the numbers reached extremely high levels, and the bed occupancy in Abs Hospital in Hajjah Governorate expanded up to 120 beds, while actually it recorded an occupancy of 200% and in September and 176% in October. And Al-Dahi Hospital in Al-Hudaydah, over 10,000 children have received a treatment in just the last 2 years, 2023 and 2024, while actually the capacity is only 73 to 120 beds. While these numbers does not cover or capture the entire country, they actually represent the daily realities of families struggling with food insecurity and collapsing healthcare system. The families face lots of challenges, especially high transport costs, which delay the care, and actually this sometimes pushes them to only solicit help only when the case is very critical. They lack lots of food assistance and routine vaccination, and that's why even after being discharged they would experience some relapse, and this will intensify their health risks. The infrastructure for healthcare in Yemen remains fragile. and nearly half of its healthcare facilities are partially functional or entirely out of service. And according to the WHO, as of April 2024, nearly 46% of health facilities in Yemen, health facilities were functional, partially functional, or completely out of service. And in view of this sudden and drastic reduction in humanitarian funding to Yemen, sustained donor engagement and flexible funding from major donors is crucial to address Yemen's escalating humanitarian crisis in order to cover their needs. And these resources are essential to keep the health facilities running. Stronger partnerships between the Ministry of Health, donors, and implementing partners are also critical. And by working together, we revive healthcare centers and ensure effectively to serve the local communities, especially in the hard-hit areas. Because for us at MSF, we urge these stakeholders to expand the vaccination campaigns to reduce the preventable diseases, especially measles, cholera, acute watery diarrhea, and the exacerbating malnutrition. Eventually, more targeted food distribution are urgently needed to help pregnant and lactating women, as well as children under 5. They need to get the nutrition they need before their health deteriorates. And unless unified and urgent measures are taken, Yemen's most vulnerable populations will continue to face greater hardships amid stretched healthcare systems.
I've been in Yemen since 2022, and I've personally witnessed the alarming escalation of medical needs. From less than 50% of primary health care functioning to shrink access to basic health care, amplification of food insecurity, lack of vaccination coverage, and the scary malnutrition situation which mostly go unnoticed. As my colleague said, MSF treated around 35,000 children from January 2022 and December 2024. The economic collapse led to a high transport and household incapacity to provide nutritional substance for family members. Dysfunctional healthcare systems. We mentioned it's 46% of health facility partially functioning, out of which only 20% are providing care for mothers and children. Many of the outpatient treatment centers are inactive. Limited health education and absence of active screening program, lack of vaccination coverage explain how malnutrition situation became so severe. Alarming deterioration of food insecurities has intensified the humanitarian crisis already present in Yemen. Out of 19 million of population in need, 17 million are affected by the food insecurity as a result of a spillover of conflict, impacting livestock and economy, climate change, including flooding, which is leaving disrupted agriculture, essential in a country where instability persists. In the past 2 years, MSF experienced extremely high admission rate, overstretched, and reach behind capacity to respond to the treatment of malnutrition in the area where we are present. Where we are not present, we have to notice that 70% of the populations lives in rural area where the health facilities are harder to reach. We don't have the full overview. On top, I would like to highlight the general insecurity situation and the tremendous impact this has on the ability for the organization to effectively operate. The FTO designations must establish humanitarian exemptions for humanitarian actors. The US funds freeze, the reduction of funding from other major donors has dramatically disrupted service for vulnerable populations in a time where extreme challenges are faced in the humanitarian sector worldwide. Today is not the time to leave or reduce commitment. Everything I've mentioned is overshadowed by the terrifying insecurity and instability in Yemen and in the region. MSF calls in actors internationally and nationally to ensure a safe operational environment for humanitarian actors to be able to deliver assistance to the most in need, ensuring the respect of the international humanitarian law, the protections of civilian, protections humanitarian workers, protection medical staff, protections of all patients across all Yemen. This is not negotiable. Thank you.
Thank you, Ilaria. وننتقل الآن للشق الطبي وتسليط الضوء.
Thank you so much, Ilaria. Now moving to the medical aspect, and we will hear from medical people in MSF related to numbers documented by the teams of MSF, presented by Ms. Marissa Lister, the medical coordinator for Médecins Sans Frontières in Yemen.
Thank you, everyone. Good afternoon. MSF has treated over 35,000 malnutrition children, malnourished children with complications in the last 3 years. These figures are from 6 health facilities across 5 of 22 governorates. These cases managed by MSF in the last 3 years are only the tip of the iceberg, as inpatient malnutrition management is only required when a patient has developed severe complications as a result, such as pneumonia. If we apply general nutritional indicators which state approximately 10% of all malnourished children could require hospitalization for treatment, this means that for every 1 child admitted with malnutrition in MSF's health facilities, there can be an additional 9 children malnourished at the community. This is an incredibly important aspect when understanding the magnitude and severity of the malnutrition crisis across Yemen. I would like now to share some of the observations from the field and what we are witnessing in Yemen. Each year, our teams have been observing a prolonged malnutrition peak or lean season. A lean season is the period between harvests where the risk of food insecurity and malnutrition are highest. This period has historically been between July and September, so 3 months. Worryingly, our teams are seeing and witnessing case numbers increase as early as May and June, extending later, as late as November, December, and worsening in terms of severity of caseloads at the peak. As Himidan mentioned in the opening, last year's peak was particularly severe, with bed occupancy rates in Al Salam Hospital and Amran Governorate up to 254% in September 2024, upwards of 200% in Abs General Hospital and Hajjah Governorate the same month. Adahi Hospital in Al Hudaydah Governorate began as an acute watery diarrhea intervention in 2022. While the teams were on the ground managing to treat the children, they observed that over 50% of them were suffering from malnutrition. There was no therapeutic feeding center in the vicinity, which prompted the opening of what has now become the busiest feeding center in the entire country, treating over 10,000 cases of acute malnutrition in just over 2 years of operations. The need to grow continues. Bed capacity is pushed to the limit, with plans to expand their 73-bed facility to over 100 beds this year. Outbreaks and vaccine-preventable diseases are a contributing factor to the malnutrition crisis we're seeing. Measles cases are on the rise in our project areas. We have seen an increase in 470% in the number of measles cases where our teams are treating since 2022. Measles and malnutrition go hand in hand. A normal nourished child is more likely to fall into a state of malnutrition following a measles infection. And we also know that a child that's malnourished is more likely to fall susceptible to measles, while also suffering worse complications as a result. We know children less than 5 years remain the most vulnerable, but I'd like to highlight two delicate groups that we're seeing in our facilities. We are seeing an alarmingly high rate of malnutrition among children less than 6 months. In ABS General Hospital last year alone, 1/5 of all admissions were infants less than 6 months old. In Al Kanawis Mother-Child Hospital, we have seen upwards of 1/3 of all admissions this year for infants less than 6 months alone. Linked to infant nutrition, we're also seeing an incredibly high rate of malnutrition among passive screening of pregnant and breastfeeding women. In 2 MSF-supported facilities last year, global acute malnutrition rates in passive screening were between 58% and 66%. That means 2/3 of all pregnant and breastfeeding women at ABS General Hospital last year were moderately and severely malnourished. We know maternal nutritional status has a direct impact on neonatal and infant health, as well as significantly impacting infant feeding practices and their well-being and the growth to follow. This is an under-recognized problem amidst a greater malnutrition crisis in Yemen. The scale of malnutrition in Yemen is enormous, and with the reduction in medical humanitarian response capacity only to diminish further this year, I remain extremely concerned with what we are expecting to witness and respond to during this year's lean season, which is just a few months away. Thank you.
Thank you, Marisa. شكرا.
We now pass to the Q&A, and please, if your question is addressed to someone, please address your question to the concerned person. Ali Jadallah from Al Balad Radio. My question is to Mr. Hameidan. What is the impact of economic sanctions on Yemen? Are they influencing only the Houthis areas, or are they impacting the entire Yemeni population? Of course, and evidently, any sanctions in Yemen are actually impacting everyone, and even the civilians, and the sanctions are imposed in the north, and according to our vision, they affect everyone, and those who are affected the most are the patients, are women and children, and but of course it affects the entire population. Good afternoon. I have several questions. The first, the mortality rates due to malnutrition. Secondly, is the diminished or reduction of funding, does it reduce or hinder the ability of MSF or other humanitarian organization? And thirdly, there are, bad tradition and customs where Yemenis are spending their money on, like the chewing cat. To what extent do you believe that this is reflecting on their malnutrition and even on the overall health system in Yemen?
In regards to the mortality rates, so overall, we've seen, although admission trends are increasing, we do see a slight decrease overall in the general mortality rates in our department. We believe that's due to just reinforcement of the nutritional care and specialized services that we offer. So in general, our mortality rates are within what are considered acceptable according to global standards. However, I would like to highlight, because I did mention that the under 6 months are the most vulnerable, and they do have higher mortality rates. So we are seeing the under 6 months infants that are admitted for severe malnutrition have a much higher mortality rate than the other pediatric malnourished admissions. Thank you.
ممكن أواصل بنفس الإجابة.
Can I add on this? Certain organizations have left Yemen, and some are on the way, and evidently this affects the level of services provided to a population of Yemen, and evidently MSF try as much as possible to expand their services in the absence of the other organizations, or where certain other organization has left. But of course, we cannot do everything alone. Are there any other questions? Thank you so much. My question is related to challenges when it comes to data collection around malnutrition in Yemen, especially in the latest situations, especially under, the bombardment of Yemen. What are the challenges that you have faced?
So the figures that we gave are facility-based. So we can talk about our experience, our malnutrition rates that we see for patients presenting to the hospital. Of course, we know that this cannot be a reflection of the prevalence of malnutrition across all the areas, since we're not there. It also doesn't reflect the community-level malnutrition. This requires nutritional surveys in order to be able to predict the malnutrition rates across the country. So of course, having limited access at community level can hinder knowing what the prevalence is, but we can speak at least to our malnutrition rates that we're seeing at the hospital.
If there aren't any other questions, we would like to thank you for your presence, and we announce the closure of this press conference.